Your colleague, Dr. Lee, was talking about some of the challenges in Surrey. I'm wondering about the factor that a lot of workers do not have sick pay. And is that a contributing factor to what's going on in Surrey, do you think? And would sick pay be a good public health policy?
I will say from a public health perspective, it is something I have been advocating for over a year. Absolutely. It is an important part of workers having the agency to stay home when they're sick. And we know it's an important part of preventing workplace outbreaks. And this is something that we know our Premier and the government here has been advocating for with the federal government. And I know, and I'll turn it over to the Minister, but I know they have been also discussing about filling that gap, I guess, where the federal program is not working as well for people. But it is an important thing about being able to stay home. And you know, part of our strategy around trying to support and protect workers in their workplaces, we recognized this last year that there are many workplaces where people just do not have the ability to stay home for a whole variety of reasons. They need the money, they don't have sick pay. It's not easy to stay home from certain jobs. And it is incumbent on the owners and operators of many workplaces to make sure that they keep all of their workers safe by ensuring that people who are sick are able to stay away and not pass it on and not transmit it within the workplace. And we have been focusing our work with WorkSafe BC, our environmental health officers across the province who do this on a day-to-day basis to make sure that COVID safety plans are in place to protect workers in their workplaces across the province.
Very short answer, Justine, yes, and I think you can stay tuned to hear from my colleague, Surrey Newton MLA and Minister of Labour Harry Bains and the Premier on this question in the next short while on sick pay. As Dr. Henry has said, there, of course, is more to dealing with workplace transmission than that, but it's an important element and will be of great assistance right now. I would say that our workplace campaigns that here in Fraser Health, Fraser Health's been leading WorkSafe BC have been helpful and effective in supporting businesses both when transmission occurs, and you've seen the strategic use of vaccination over the last number of months, the priority vaccination given to people in high transmission industries such as food processing and agriculture. And so all of that is part of a strategy we need to do to reduce transmission in workplaces, and those efforts, those COVID safety plans that have been in place for a while have been key to that. But there's no question. That's why the Premier has been advocating for sick pay, a national program for sick pay, which in our view would make the most sense, and why he's made it clear that he'll be leading steps to fill the gap in the absence of that.